So our group decided to look at the incremental differences in symptoms and quality of life for very young women who receive ovarian suppression for treatment of hormone-sensitive breast cancer, in addition to tamoxifen, after the soft trial results came out showing that for women with early-stage hormone-sensitive breast cancer, some of them seem to benefit. We said, okay, what's the bang for the buck though? And of course the soft trial was a clinical trial. Our study looked at women who are in a prospective cohort study that is just following women, very young women, women 40 and under at diagnosis, from diagnosis through long-term survivorship, and looking at myriad things, including their quality of life as well as their treatment. So we were able to look at over 400 women, and 120 had been on ovarian function suppression in addition to tamoxifen. And we were able to compare the groups of women, again, not in a randomized way, but in an observational kind of real world setting, the women who got ovarian function suppression and tamoxifen versus women who got tamoxifen alone. What we found was that, not surprisingly, and consistent with the soft quality of life analysis, the women who were on the ovarian function suppression had a higher symptom burden. They also, in the chemo group, because some women got chemo and some didn't, in the group of women who got chemotherapy, there was actually a decrement reported in their overall quality of life in the 3 domains of the instrument we use. So we use the CARES, which looks at physical, social, and sexual side effects and symptoms in cancer survivors, specifically breast cancer. And so when we use this very fine-tuned instrument, we found that there was a difference in global quality of life for women who got chemotherapy and ovarian function suppression along with tamoxifen versus women who didn't get the ovarian function suppression in that same setting. That wasn't true for women who weren't treated with chemotherapy. For the no chemo group, the global quality of life was the same, and there were just more symptoms in the women who had the ovarian function suppression, namely vasomotor symptoms. These data actually have a lot of implications, I think, for our young survivors. It's great news that we have new options for treatment for our young women, and we can say, okay, tamoxifen is good if you're a low-risk patient, and maybe that's enough. But if you're a higher-risk patient, you might say, okay, we want to suppress you too because your risks are higher, and we think that a combined hormonal approach will improve how you do. That being said, it's important that we measure the aftermath and what we're doing to patients so that they can make both individual decisions at the moment as well as in the future. If they're really suffering from some of these symptoms, we know that it's probably all due to the suppression of the ovaries in certain settings, making it worse. And so then you can weigh later on with them, okay, we have data to say this is what happens. You're experiencing that. If it's tolerable, fine, let's go on. If it's intolerable, maybe you say enough already, and you make an individual patient decision that way.